Hi everyone, welcome to another Rethink webinar. As we often do, we're going to wait another minute or two just so people can log on and get settled, and then we'll get started. All right, welcome everyone. Thank you so much for joining us today. My name is Erin Mayberry, and I am Director of Community Engagement at Rethink Behavioral Health. Our webinar today is a little bit different from the typical webinars that we present. This is going to be a focused training on our medical necessity assessment tool. So for those of you who may not be familiar with Rethink, we are a behavioral health software solution. We provide clinical practice management, training, and billing products on our software. Our medical necessity assessment is part of our clinical package. So this is a patent pending tool, and it was designed to assist clinicians in being able to recommend appropriate ABA dosages when you are submitting to a funding source for authorizations for ABA services. So I'm actually going to be sharing my screen and walking us through the medical necessity assessment tool and how it works today. If you guys have any questions, feel free to type them into the chat, and we will try to get to as many of those as possible at the end of the webinar. This is also going to be recorded, so we will provide all of the materials that I'm going to be sharing with you today, as well as the recording of this so that you can use it for other training opportunities or share it with your staff. All right, so if you are familiar with the Rethink platform, the medical necessity assessment tool lives in this client area here. And I'm going to be using a demo client to walk through a couple different versions of the assessment today. So when you open a client's profile, you're going into the assessment tab. And you should be able to see the medical necessity assessment here. For anyone currently using Rethink, if you do not have access to the medical necessity assessment, just reach out to either our support team at support@rethinkbh.com or your customer success manager, and we can guide you into getting that set up. So when you come into the medical necessity assessment, you're going to see any previous assessments that have been completed. This is a brand new client in our account, so I'm going to work through this as if we were doing an intake with this client, and this is our first authorization for the client. So when I go to create a new assessment, I have two options, one for the initial service authorization and another for any concurrent reviews. So I'm going to start with the initial service authorization. With the treatment model identification, you are first just going to record some basic demographic and background information for your client. So first, you're going to indicate their current age and the age that they were at initial enrollment. So if this individual, for example, was 4.1 years of age, I can indicate that here, and I can even add additional comments for anything that I'd like to for any of these questions that I have. Maybe the initial age at enrollment was 3.6 years. And the number of years in ABA therapy, as well as the number of hours that the client is currently available. When I move on into planning considerations, this is going to really be a records review of all of the documentation that you have for this client, and then also your treatment recommendations. So first, the diagnostic evaluation report. This is going to include any of those diagnostic assessments that may have been completed. You're going to indicate present if one or more of these are present. And for therapy evaluation, you're going to do the same if you have any additional information on therapies such as physical therapy, occupational therapy, speech and language. For norm reference assessments, you can indicate whether or not any of those are present and have been completed. So these are things like the Vineland, SRS-2, etc. Same thing for criterion referenced or development assessment. So for example, if I've completed a VB-MAP assessment, I can include information here. And then you're getting into your treatment recommendations. So how many goals you are recommending, the developmental domains that are being addressed, and then the number of goals that you're going to target within each domain. So for example, you're going to count one goal for any of the social communication targets you have, things like language processing, teaching language, nonverbal or vocal verbal language. Same thing with social interactions. So you're going to count one for every goal that you have here. And again, for restrictive and repetitive behavior goals. Then you're going to indicate whether or not there are any parent training objectives. You're going to mark present if one or more training goals are included for a parent. Quality of life indicators are included as well. So here you're thinking about treatment goals that are addressing interpersonal relationships, social inclusion, physical well-being, etc. And if the treatment plan is addressing client dignity, so that may be things like cultural considerations, effectively communicating with clients and caregivers using least restrictive environments. And if the individual is enrolled in services other than ABA, you can indicate that here. And then again, in the comments, you may specify what services are being provided. Then we get into specific learning considerations. So with behavior problems, you are going to indicate present if one or more behaviors are present as part of your treatment goal and evaluation information. So things like aggression, self-injury, elopement, property damage, and so on. With verbal behavior skills, at least one or more verbal behavior skill deficits need to be present for this to be marked as present. Same thing with prompt dependency. You would mark present if evidence of prompt dependency is addressed as part of your treatment goal. So that may be client producing only target behaviors when they are prompted and unable to self-initiate. Defective social skills may be things like the client engaging in age inappropriate behaviors, unable to answer questions or take turns appropriately. With reinforcer dependency, you're going to mark present if the client will only respond when a reinforcer is offered. Example, if a client is only responding to a verbal answer if there is a food item that is being presented as a reinforcer. Failure to make eye contact, again, present if that is, not present if it is not. Sensory defensiveness, Maybe evidence when a client has heightened negative reactions to sensory input, so you would mark present or not. For self-stimulation, that might be things like hand flapping, spinning objects, rocking, etc. With obsessive compulsive disorder, these are behaviors, so any rigidity to routines, needing to line up toys, needing to wear specific clothing, material, things like that. Hyperactivity is if the client engages in markedly more active behaviors than same age peers, like having difficulty sitting still, having difficulty finishing tasks. And then if there are any comorbid medical conditions or comorbid behavioral health conditions, you can indicate those here as well. Then moving into any environmental considerations, you're going to indicate, again, present or not present. If there are any scheduling conflicts that prevent the individual from being able to participate in your services or any of those scheduled appointments. If frequent illness prevents them from participating in over 20% of scheduled services. And same thing with frequent cancellations. If that is preventing the client from being able to engage in those services over 20% of the time, then you would indicate present. And also, if any issues with changes in address or phone number or challenges with email or voicemail that are actually prohibiting them from engaging in services, or at least creating barriers to them being able to participate in services. If you have any missing baseline data collection for that initial authorization, you would indicate present. And that is measured by having at least 3 data points for each of your goals. So if there are less than 3 data points for baseline, you would indicate present that there is some missing baseline information. And then if you have an authorization that is not available, so maybe this individual has never had services before, maybe they are coming from a different organization, you don't have a copy of that authorization, you would indicate present if the authorization was not available. Here with the diagnostic symptoms considerations, we are really looking at the level of severity of these presenting characteristics for that individual. And if you're looking at the screen going from left to right, this is going to be mild, moderate, and severe. So at this point, the tool has determined whether or not this individual is going to need comprehensive or focused ABA, or even potentially that medical necessity criteria have not been met. And depending on how you respond to the questions on this page, it is then going to take the total number of hours that are recommended for services per week and is going to allocate to these areas here. So once I complete my assessment, you can see that the tool is recommending comprehensive ABA for Henry at 34 hours per week of direct services. With those 34 hours, they are allocated based on my responses to that previous page. Rethink is asking for clinician feedback on whether or not you agree with the tool's recommendation. And we are using this to continue to calibrate the tool to make sure that it is clinically appropriate for all clients of all age ranges. So once you've completed the tool, we ask if you agree with the tool's recommendation. And this is going to be specific to your clinical recommendation. So it doesn't take into account things like scheduling barriers or issues with providing that service. It is what you are clinically recommending for the client. So you would mark yes if you agree within 3 hours of what this recommendation is for comprehensive ABA, and you can select no if you disagree. With a focused recommendation, that would be within 2 hours of what the tool's recommending. So I'm going to say yes, I do agree with the recommendation. And then we're asking, what is the total number of hours that you are going to be recommending per week of services? Again, that may vary slightly from the tool's recommendation. So even if you do agree with the recommendation, you may for some reason be recommending 32 hours, or maybe you are agreeing with the tool and saying you are going to recommend 34 hours. In addition to that, if you have additional comments that you think would be helpful for us, then we encourage you to include those here. If you have any questions about what the tool is recommending, we also encourage you to write those in here. Definitely, if there's any disagreement with the tool, we want to hear why, again, so that we can continue to improve the tool as we get more and more feedback from our users. Once you complete this assessment, you are going to have a summary report that is going to be a PDF of what you see here on the screen. For those of you currently using Rethink, you can save that directly over to the file cabinet to share with other staff or maybe parents and caregivers that you've given access to. And you also have a detailed report. This detailed report is going to pull up not only that summary that you see, but it's also going to go line by line with every single question and the assessor's responses, including any of those comments that you have added. So I know we've gotten a lot of questions, and some of these were even from a previous best practices with the M&A webinar on how do you incorporate this into your treatment plan that you are then sending to a funding source. With Rethink, you can use the funder report area here to create those reports that you are then sending. So you have authorizations that you can send over based on the templates that you have built in your system. And I have an example here that we are actually going to be providing to you a little bit later on. Give me 1 second to pull it up. So this is an example of a report that we have built with one of our demo accounts. And you can see I've included my VB-MAP test scores. I've included some baseline data for my behavior goals that I'm going to be targeting. And I have some recommended goals that I want to include for my skill acquisition. At the very bottom of this initial authorization request, I've also included that summary report of the medical necessity assessment. So as you're building out a template in Rethink, you have an option of a custom field, and that allows you to upload any pictures or things from your desktop. You can save that summary report to your desktop, and then you'll be able to upload this image to embed directly into the report that you're creating. The other option is to include that detailed report just as an attachment when you submit for your treatment plan. All right, so now that we've done an initial assessment, I'm going to go back and do a reauthorization version so you can see what that looks like. Now when I come in here, because I have a completed assessment, you're going to see the most recent assessment at the top, the type of assessment that you completed, and that overall recommendation. And again, you have some options over there to download the report, to edit the assessment, and delete it based on your permissions in Rethink. For a reauthorization, a lot of what you saw earlier is going to remain the same. So you're just going to be updating it based on this authorization period. So again, Henry may fall into that 4 to 7 years. At this point, maybe he's 4.5 years old. And again, age at initial enrollment stays the same. Number of years in enrollment is still around 1 potentially, so we're still in that same category. And the number of hours he is available is going to remain the same. When you get into the planning considerations, you still have the present or not present that you saw earlier, but now that we are comparing this to previous authorizations, it is either present or updated from that previous authorization, or potentially not updated, not current. And then you have that same option for not present. Maybe here I'm updating my VB map results for the score. I have updated my behavior assessment. And then again, I'm going to be specifically recommending all of my treatment goals. Here, instead of documenting other services, you are just documenting whether there has been care coordination with the providers of those other services within that last authorization period and continuing on into this authorization period. This section is new, so we're looking at the responsivity to treatment from that previous authorization period. So the first thing you see is the average number of monthly outcomes that have been met. So what you're going to do is count 1 for every goal that was met and divide by the total number of months from that authorization period. Then for parent goals met, you're just going to count 1 for each parent goal met. And then the number of resolved treatment challenges include anything from the previous authorization that has been resolved. So maybe that is scheduling barriers, maybe that is changes to the home environment, anything like that you can include here. And again, if you need to, you can provide additional comment. With the learning improvements from that learning consideration page that we had in the initial assessment, you are now going to compare the previous authorization to that current authorization. Right now, Rethink does not auto-populate this information, so you will need to have that information available to you, but that is an update that we are going to be making to the assessment tool in the future. So here I'm just going to indicate my previous status and then update that if needed. And I'm going to do the same thing with my environmental challenges. So again, comparing the previous authorization period to that current status. This one is new, so limited training opportunities. If there were any situations where you were unable to target specific goals, you were not able to get to any of the goals that you had included in your treatment plan for whatever reason, you can indicate that there were limited training opportunities. And that would be present if it impacts more than 20% of the treatment goals. If you are unable to implement 80% of those treatment goals, then you're going to indicate that here as well. And then finally, you get to that diagnostic symptoms consideration page again. This is the same, so you're just going to update it. And now it looks like 31 hours of services per week are being recommended for Henry, so still falling into that comprehensive category. And again, those hours are allocated into the areas based on how you responded to the previous question. You're going to, again, fill out this agreement if you agree with the tool's recommendation or not, and the total number of hours that you are going to be recommending per week of services. I see a couple questions coming in about specific ways to answer questions, and we actually have an instruction manual that we're going to be providing to everyone. So we are going to send that to you in a link in just a minute. If anyone does have any other questions, I'm happy to answer those now. We do have data on the recommendation of the tool versus the clinician recommendation. And we are starting to work with funders on data with payers as well. So eventually we will be able to present those data to you. So there are a couple questions as well on the numbers on the tool. 1 second, I'm going to go back and just highlight what I mean by that. All right. There are a couple of areas where the numbers don't necessarily match up. So for example, number of enrollment years is less than 4, or your option is 3 to 5. These are updates that we are aware of and are currently making with the assessment. So in that instruction manual, we have guided you into how to respond to those until that update is made. So for example, this is going to show less than 2 years. So you can assume that anything 2 years and less would be indicated with the less than 4 years versus the 3 to 5 years. You can use the ABLES grid instead of the VB-MAP grid. So that was just one example of being able to include an assessment into the template. We do have an integration with the VB-MAP, so it makes it very easy to access that scoring grid within Rethink and then upload it to a template. But you can definitely complete the ABLES and then upload any of those grids that you would like to include in a funder report in Rethink. Just to clarify, there was a question about the discrepancy when I gave an example of 31 hours and then saying I recommended 32 hours, but I agreed with the tool. In that instruction manual, you will notice that the agreement has a variance of about 3 years for comprehensive ABA and 2 years with focused. So for example, if the tool recommended 31 and I said, yes, I agree, I'm recommending 32, that falls within that 3 hour category. For those of you who missed how to access the tool, I see a couple questions about that. If you currently use Rethink and you have our clinical tools, then it's going to be in the client portal. And you'll simply select your client and then go into the assessment area. You should have the medical necessity assessment available to you. That also is a permission-based assessment. So if you don't have access to it, the first thing you can do is ask a system administrator for your account, whether or not you have access or if you can get access. And for those of you who have been using Rethink for several years, this tool was made available only a couple of years ago. So it may be something that just needs to be added to your account. If you don't have the medical necessity assessment available even to a system administrator, you can contact the customer success manager that you have been assigned, or you can contact support at RethinkBH.com and they can help you with getting access. I'm actually going to type that into the chat right now so that you have the email address if you need it. There's a couple questions coming in just about how the tool takes into consideration the way that you are responding, and there is an algorithm that we use. So the algorithm is taking into account different weights based on the different responses. The tool was developed by BCBAs and our scientific board. So we have put a lot of thought into consideration into how we're weighting that based on a lot of the research that is available to us right now. Unfortunately, no, we will not disclose the back end of those calculations at this point, but we can share additional information about just the ways that we are taking into account all of the different areas of the tool. So if you have any questions about that, feel free to email me directly, and I'm going to put my email address into the chat now. Currently, the medical necessity assessment is specific to an autism diagnosis, so we are not taking into consideration other developmental disabilities at this point, as it is recommending ABA dosage prescriptions, more specifically to autism right now. All right, if you guys have questions, feel free to type them in, but at this point, I don't see any more coming in. I am going to share with you a couple more links. The first one that I am sharing is actually a webinar that we did 2 weeks ago, and many of you probably found out about this webinar through that. But for those of you who did not, we had a webinar 2 weeks ago with ABS Kids, who was an early adopter of the medical necessity assessment tool, and they have been implementing this across their organization with over 100 BCBAs. So they talk about best practices with how to roll out the medical necessity assessment tool as a training opportunity for staff and being able to appropriately prescribe ABA dosages when they are submitting to funders. So if you want to check out that webinar, you can do so following the link that was just put into the chat. We are also working with ABAC and providing a webinar tomorrow for anyone who is interested in more multidisciplinary services and working together on care coordination. We are presenting a webinar from 12 to 2 p.m. Eastern, and that one actually comes with 2 continuing education credits. That webinar is on building a collaborative interprofessional team to support inclusive decision-making for teams who support those with ASD and related disorders. That is a mouthful, but I am going to share the link with you in the chat. Again, if you would like to join, you can do so by going to this page here and signing up. Again, that is 2 CEs, and there is a price associated with that, but if you use the discount code RETHINK25, you will receive a 25% off on that listed price. So that is also in the chat. Rethink25 is the discount code that you can use when you're signing up for the webinar tomorrow if you'd like to join it. This will be available as a recording, so you are going to receive the recording of this webinar as well as the instruction manual via email in the next day or 2. One other thing I would like to mention, people are asking about CEs and asking about pricing. In July, we are going to start hosting webinars with CEs. Not all of our webinars will have CEs, but we will try to do at least one a month that offers a free CE or 2. And in July, we will actually be hosting with Dr. Bridget Taylor and Dr. Tyra Sellers. They're going to be discussing RBT supervision, and that will have one free CE for anyone who is a current Rethink customer. And you can purchase those CEs if you are not a current Rethink customer. So you will get more information on that webinar coming in July in the next few weeks. But again, that will be our first Rethink webinar that has CEs available. All right, it doesn't look like there are any other questions coming in. So again, I want to thank you all for joining today. Just a reminder, you will receive an email with the recording and the instruction manual. And we will also include those links for the upcoming webinar and the previous medical necessity best practices webinar for anyone who's interested. Hope you all have a great rest of your week, and thanks again for joining us. Bye, everyone.